Hi everyone, happy Monday. I wanted to answer a few questions that I got from the videos that I posted last week on what to expect during a PAP. The first is about the use of lubricant. Now you may think that your doctor is putting a ton of lubricant or should put a ton of lubricant on the speculum before your PAP, but this is not the best idea, and let me tell you why. The lubricant can actually disrupt the specimen, and the lab will say the specimen is unsatisfactory, which means you need to come back and repeat the PAP, and nobody wants to do that. So typically what I do is I put a little bit of lubricant just on the sides, or I dip the speculum in warm water so it provides some lubrication without actually having to put a lot of lubricant. Number two, if you've had a history of sexual abuse or sexual trauma in the past and you feel comfortable disclosing this to your provider, I encourage you to do so. A lot of times offices will have pediatric speculums, and I have one in my office. It is much smaller than a regular speculum, so you can see the size of a regular and size of a pediatric. So it is significantly smaller. And I reserve these for my patients who have a particularly hard time with PAP tests. So if I can see your cervix using a pediatric speculum and I can do an adequate exam and a PAP test, then, why not? So something for you to think about. And lastly, if your office allows a support person to come and help you and just be with you during a PAP, then by all means, bring a friend.